Продовжуємо роботу в українському кризовому медіа-центрі.
We continue our work at Ukraine Crisis Media Center. Now, updates on measles incidence and vaccination in Ukraine. Our guests are Volodymyr Kurpita, Director General of the State Institution Center for Public Health of the Ministry of Health of Ukraine, and Laura Bill, Deputy UNICEF Representative in Ukraine. Welcome. Good afternoon. We thank the media for your interest, that you highlight the situation with the measles, and we provide weekly updates, and today's information will be provided as of 2nd of February 2018. And the situation with measles continued to be tense, and according to the Center for Public Health, first week of 930 people fell ill, and this is 7% more than during the fourth week, and during 5 weeks of 2018, 3,554 people fell ill. Out of them are 1,165 adults and 2,382 children, and more than 2,000 are hospitalized, and one lethal case was confirmed. A woman of 28 died in Ivano-Frankivsk Oblast of complications, and on behalf of the ministry, our hearts go out to the relatives of this woman. And once again, we want to stress that the complications are registered in 7 or 11%, and lethal cases, one case in 900,000, and 4 people died, 2 children and 2 adults. The majority of cases are registered in Ivano-Frankivsk Oblast, 804, in Odessa Oblast 640, Zakarpatska Oblast 549, Chernivetsky 444, and Lviv Oblast 242 cases. And the least cases are in Chernihiv 1 case, Kharkiv, Lugansk, Sumsky Oblast 2 cases, and Rivnensk 3 cases, and Zhytomyr 8 cases. And as of the 2nd of February, at least 1 case of measles in every oblast, and the Chernihiv Oblast 1 case was recorded last week. So about the situation with vaccination against measles, as of 1st of February 2018, in the framework of reinforced immunization, we vaccinated 73% of children who missed the first dose of vaccine and were planned to be vaccinated, and 78% of children who were not vaccinated with the second dose also received this vaccine. And demand on this vaccine increases, and this is connected with the increase of the disease, and the stock of the vaccines is 267,000 of doses. During last week, they used 41,000. 898 doses of MMR vaccines, and in February, and we planned to do it in April, but we wait for the supply of 220,000 doses of MMR vaccines, and they will be delivered to Ukraine. This is a Belgian vaccine of GlaxoSmithKline production, and it will be delivered by UNICEF fund in Ukraine, and after this, these vaccines will be distributed to the regions, and they will be delivered there. So we are grateful to our partners from UNICEF Foundation for the possibility of organizing of such important delivery of our vaccine in the shortest period of time. This shipment will enable us to address the ongoing measles outbreak in Ukraine, and some regions exhaust the vaccine stocks, and the Ministry of Health of Ukraine continues to redistribute the available stock to the regions where the supplies are not sufficient. So now I would like to give the floor to Laura Bill, Deputy UNICEF Representative in Ukraine. Welcome.
Thank you for this kind words. Good afternoon, everyone. So, as you know, and Dr. Kurpita already mentioned, Ukraine is currently facing a measles outbreak, which is a direct result of the low immunization coverage. This outbreak has happened because of the immunization coverage that has fallen down over the recent years. And unfortunately, Ukraine has the third lowest coverage rate for measles in the entire world. In addition to that, Ukraine also unfortunately has the lowest coverage for DPT vaccine. However, we are very thankful to the Ministry of Health, to all the vaccinators around the country for all the fantastic work that they have done over the last few weeks to increase the first dose measles vaccination coverage from 42% in 2016 to 93% in 2017. As you probably know, UNICEF provides support to the Ministry of Health and other partners to urgently end the measles outbreak, as well as increase and maintain high level of immunization coverage. We provide support to the government through the procurement of vaccines, through strengthening the immunization system, and also informing parents about the importance to protect their children through vaccination. To meet the growing demand, as it was already mentioned, UNICEF, at the request of the Ministry of Health, has been working with the manufacturers of measles vaccine to ensure that the next consignment to Ukraine will happen within the next few days. We are very pleased to confirm today that Ukraine will be receiving additional 220,000 doses of the measles MMR vaccine already at the end of February. We also informed the Ministry of Health about another 2 upcoming deliveries, one expected in late March, around 800,000 doses, and another expected in late May, around 77,000 doses. Furthermore, in the framework of the agreement that UNICEF has with the Ministry of Health, through the regular procurement, UNICEF will also deliver an additional 900,000 doses of MMR vaccine in the fourth quarter of 2018. With these additional planned delivery in the pipeline, we are very much confident that Ukraine will not run out of vaccines, despite the increased demand that has been created through the outbreak. While the Ministry of Health is urgently addressing the problems of low vaccination, parents and caregivers must also play their own role in protecting their children by ensuring that they receive all their routine immunization on time. UNICEF is therefore encouraging all parents to check the status of their children's vaccination. We urge all parents of all children in Ukraine who missed any doses of any vaccine to get their children to the health facilities. I would also like to highlight that in Ukrainian society, needs of a higher rate of immunization coverage to ensure that all the protection of all children and adults are required. Ukraine needs to reach at least 95%, and most importantly, this level of coverage needs to be maintained year after year to prevent any infectious diseases. Thank you.
Thank you. Зараз час на запитання, наскільки я розумію. Панове, якщо маєте...
Thank you, and now it's the questions and answers time. Please name yourself before you put a question to the speakers. Organ Skorodina 1+1 TV channel. Can you please inform us about the vaccination against hepatitis, the one that should be administered immediately after birth? Well, according to the vaccination calendar, all the newborns are vaccinated against hepatitis. The first cycle it's done in 3 cycles usually. The first one is usually administered right in the hospital where a child is born. The rate of vaccination, for example, for the last year was at about 75%. And according to the information that we now have at the Health Ministry, we do not see any lack, any shortage of vaccines at the regional level all over the country. As I have already informed the public, these vaccines are supposed to be available in every medical facility which is supposed to do this vaccination, but the responsibility to supply these vaccines rests with the local authorities. And it's up to the regional authorities, to the authorities of the oblast, that are the administrative units of Ukraine. They are in charge of providing the necessary amounts of the vaccine for the vaccination of this type. Next question, if any. If there are no more questions, which is rather surprising, but still, thank you very much for your information, and let us conclude our briefing with this. Thank you.